In my previous lecture, we have discussed about the importance of ependymal cell and the formation of cerebrospinal fluid or CSF. So, if there is any infections in the CSF, or let me say meningitis, if there is meningitis, inflammation of the meninges, so or treating different types of meningitis inflammation. Here some of the antibiotics is not a good choice of drug. For example, certain antibiotics like penicillin and most cephalosporin, they are not choice. These drugs are not a choice for treating the meningitis or different types of meningitis. Why? Because CSF, the choroid plexus, it removes the penicillin from the CSF very efficiently or actively remove from the CSF. So the effectiveness or the penicillin cannot remain in the CSF for longer period to completely remove the bacteria or to completely recover from the infection. So instead of penicillin, there are other drugs like ceftriaxone with broad spectrum activity against gram-positive and gram-negative bacteria. These are the drugs is the choice for treating the meningitis, which are not removed from CSF effectively like penicillin. So these drugs, they remain in the CSF and helps complete recovery of the from the infections or killing the bacteria completely. So in this case, penicillin may not be a very good choice to use. However, if the infection or meningitis, the blood CSF barrier become leaky. So because of leaky, the tight junction is loose enough in the epithelial cell of the choroid plexus, and because of that, the penicillin concentration may increase in the CSF up to 20% or more. But as soon as the bacterial infection subside or when the choroid flexure regain its function, again the penicillin is removed from the CSF. So the remaining or penicillin cannot remain in the CSF for a longer time. So that because of that, penicillin may not be a good choice of treating different types of meningitis. Okay.